Okay, so now we're going to be looking at the second part of your criteria 2.3, which is around policy, or in this case, effective policy. So the aim is to evaluate the relationship between the three theories that we've just looked at and the development of health policies. So we're going to start by asking the question, what is health policy? What is a health policy? And what is actually a good health policy? What are some targets for health policy? And finally, can we, by looking at a health policy, find a link between either one of those health inequality theories that we've just looked at and that health policy? If you are confused, that's a good place to be, because then you can actually focus and I will answer your questions. Okay, so what is a health policy? So policy is a noun. It's a set of ideas or a plan of what to do in a particular situation that has been agreed to officially by a group of people, a business organization, a government, or a political party. Sorry, just needed to drink then. And this definition is by the Cambridge Dictionary. So in other words, a policy is saying, okay, there's a situation, here's the situation, what we're going to do about it, here's our action plan. Okay? Health policy refers to decisions, plans and actions that are undertaken in order to achieve specific healthcare goals within a society. Okay, so let's say, let's pick a situation that we're currently facing in the UK. Coronavirus, okay, super popular and relevant. A health policy then would be saying, here's the situation. What can we do in order to solve this situation? What is our game plan? What is the process, or what are the processes that we need to take in order to reach people to say, we're looking at this problem, we're trying to solve it, can you work with us in order to eradicate this situation? Okay, that is what a policy should do. So an effective health policy would define a vision for the future. So let's look at the coronavirus. So our vision for the future is we want to see a corona-free nation, let's say by the end of 2021. Okay, so we should have a clear vision for what the future is, which is why we have our Prime Minister come every day giving us briefings of how to get I'm sorry, I don't listen to a lot of what he says. I'm not saying that's a good thing, by the way. Okay, right, so an effective health policy should define a vision for the future. An effective health policy should establish targets and points of references for the short and medium term. Okay, so that's action points. So we've said that our clear vision for the future is that by the end of 2021, we will have a corona-free nation. But before we can get to 2021, we have to get to next month. We have to get to the end of the year, and we have to get to the start of next year. So you need to have targets for the short term and the medium term before you can actually achieve the long term, which is 2021. An effective health policy should outline priorities and the expected roles of different groups of people. So who are the people that the government need to work with in order for us to have a corona-free nation by the end of 2021? We need to work with the scientists, we need to work with doctors and nurses, law enforcement agencies, and of course the people. So you've got to outline the priorities for key players in order to be able to achieve that vision for the future. And then you build consensus and you inform the people. So when we've gotten all our priorities right, we've gotten all our key players, we've established short-term, long-term, as well as clear vision for the future, That's building consensus. Now you have to inform the people. Okay, you inform the people by the Prime Minister does some sort of daily briefing or weekly briefing. There's lots of information on social media, there's lots of information in the news, billboards and posters, etc. Okay, so because what good is an effective policy if people don't know about it? Okay, so a policy can target different levels. A policy can target the individual. A policy can target community. A policy can target specific population group, or a policy can target society. As you can see, it kind of snowballs that way. So the more if a policy is targeted at an individual, it's not going to have obviously as much impact as when you target the society. So that's pretty self-explanatory. So an effective policy should do at least one of these. Okay, so for whatever health policy that you're looking at, when you start to evaluate the effectiveness of that policy, you've got to ask yourself, has this policy managed to reduce health inequality? Has it managed to improve the health of a community of people, health of the nation? Has this policy inspired economic growth? Has this policy led to an increase in life expectancy? Has it improved access to healthcare? Has it improved the physical environment? Is it reducing economic expenses? Does it improve the workplace? Does it create healthy communities? Now, if you can't answer, and I'm sure you could probably come up with a more extensive list than I've made, but if you're looking at your health policy and you can't honestly answer that it has done at least one of those, you've got to ask yourself, is that actually an effective policy?